Approximately 10 to 15% of children in the US have a developmental delay. However, the majority are not identified in time for early intervention. We know this gap is even larger for Black families. These delays in early intervention can have a negative long-term effect on children and families. So I thought I'd come up with an idea to close this gap by looking directly into the community for some safe spaces where we can identify children and families that have a harder time being connected to early intervention services. We know that it's important for safe spaces because there are historical fears and abuses around studies and tests being done with African-American families. So the safe space that I identified would be the barbershop. In the African-American community, the barbershop is a community hub. It is a place where people feel safe and they gather, they conduct business, they have familiar interactions, and there's a lot of laughter and joy. This is a great place for projects that better the welfare of the people in the community because it has been a place where people have provided resources to people. There's been programs in barbershops where they have conducted blood pressure screenings, conducted things like mental health resources and literacy when you have the children read for cuts activities. So we know this is a good place to present a project like this. I also talked with the Sankofa UC Davis program for African-American families of children with disabilities. And they also are identified as a safe space to be able to discuss ways to close this gap. So when thinking about barbershops, I went directly here into the South Sacramento community and identified the Heritage Barbershop, which is a Black family-owned barbershop that's operated for over 40 years here in the community. And they've done activities like served food to the unhoused community. They have offered free haircuts in the park. They have offered blood pressure screenings and done fundraising and did a lot of things in the community. They do a lot to provide for the community and the resources for not only the patrons, but also the barbers that work there. Most recently, they're being featured on a PBS special for the Confess Project, which is a project where they directly connect patrons in crisis directly to mental health services in the community. So with our stakeholders, that would be the Heritage staff and the Sankofa team. We discussed how would we implement this in a barbershop. So the first thought was we would use the ASQ screening, which is the same screening mentioned earlier. It's the easiest screening for people to understand. And we would be able to introduce that at a child's first haircut. We would need to give a brief education to the staff, the barber staff, and that would then in turn provide a way for families to electronically access the ASQs right there from the waiting area. So we talked to the stakeholders and we discovered two things during this meeting. One was that we would need a community broker. The barbers, in order to buy into this idea, it would need to come from another barber. The other was that both the barber staff and the parents asked about resources on helping children during the haircut, if they have sensory issues and other things going on, how they can better support the children during that time. So we started with the first thing, which was our community broker, and we identified a master barber, Mr. Marichelle J. Brown. So let's give it up for Master Barber Marichelle J. Brown. Marichelle J. Brown is the owner of the Heritage Barbershop. He is also developed 2 barbering programs for the Paul Mitchell system and is currently the lead educator for the Milan Barber College in Vacaville. He also is a family member of several neurodiverse children. So we feel like he is a good candidate to be well invested into this project. Now for our materials, we know that we need to develop a flyer that would have a QR code on it. We could have either a flyer, or we could have a small, kind of like a poster that they could just scan right from the wall, or maybe a bookmark that we can give out when they get the first haircut certificate. So those are some of the materials that we decided to develop. When they scan this, they would want it to go directly, we'd like it to go directly to a short video to explain to the parent what exactly is the screening. And then from there, go into the screening. So here's the short video that we developed.
Hello. Congratulations on your child's first haircut. While you're here, let's check in and see how they are growing and learning. Let's look at 5 areas of development: communication or listening and talking, fine motor or finger movements, gross motor or body muscles, problem solving or thinking and solving, personal and social, or playing with others. Screening can help you explore new and fun ways to play with your child, identify any areas for support, or get help if needed. Let's get started. Click here to fill out some questions. For support, you can contact us here.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.